Bolovinaka, and welcome to Empower and Protect. I'm your host, Melania Tora, and we're here today joined by Salote, who is Fiji Red Cross Society's Health and Care Coordinator. How are you doing this morning, Salote? Great. I'm good. Thank you so much for coming on the show. We're excited to talk about all things Fiji Red Cross and how we can empower our young people, our women, and our people with disabilities through the work that you guys do. Okay, so Salote, tell us a little bit about what Red Cross does, what Fiji Red Cross Society does, and your role within the organization.
Fiji Red Cross, as you know, is a humanitarian organization. It has an auxiliary role to government of the day. We are governed by our 7 fundamental principles. And with the society, we have 16 branches across the country within the 3 divisions.
Oh, wow.
So we have 7 in the Western Division, that is from Singatoka right to Nalawa. We have 6 in the Northern Division, which includes Rambi and Taviuni, and the 3 in the Central Eastern Division, which includes Rutuma.
Oh, wow.
As well. So we have around 800 volunteers who are registered under the society. And as you know, Fiji Red Cross is a volunteer-driven organization.
Right.
And they are the very important component or role they play in the societies, because they are hands and legs in the communities. They conduct advocacy, which we mandated to as first responders, implementation of activities that builds up to preparedness during disaster period also. So yes, my role is I'm a health and care coordinator for the society, and I looked after some of our health programs that is aligned to the national priority as well of the country. Out of the programs that we have, I have around 6 programs that is under the the health and care department. Sorry. One is a community-based surveillance, where we work with the Ministry of Health in training community health workers in surveillance within the community. So they focus on community case definitions, on symptoms, and then we do community visits with the community health workers and refer them to health centers if they fit the community case definitions. So the work we have around the community-based surveillance, we work very closely with the Ministry of Health, with the zone nurses, with the sister in charge for divisions, and reports come from our trained community-based surveillance community health workers, where they send in weekly reports, and it is generated and shared with the Ministry of Health. So that is one part of it. We also work with Ministry of Health under the NCD program, HIV is part of it. We also have a component under mental health and psychosocial support within the health space, community first aid, and our WASH program.
Wow.
So
amazing.
that's basically some of the programs that is run under the health and care space. But the cross-cutting with this program is our Jessie and youth.
Oh, wow.
As most of our volunteers are youth.
Great, thank you so much, Salote. What a beautiful, you summed that up very well. Thank you for that. You know, one thing that I noticed about Fiji Red Cross that everyone knows is that you're such a big part of this country's disaster response. I mean, whenever we have a cyclone or a hurricane, you just see that Red Cross, you know, that you guys are first responders on the scene with your youth, with your volunteers, right there, just ready to help. And I love that. But I love that also what you're saying is it's not only the natural disaster response that you guys are focused on, it's the health, it's the NCDs, it's like so many, it's so much broader than we think it is. Yes. And I love that your organization touches on things that are relevant instead of just like an overarching only natural disasters, but you're also talking about HIV, you're also talking about AIDS, because that's what we're facing right now as a country. So I love that. I want to ask you to talk a little bit about the current projects that you are doing as an organization, because we talked a little bit off camera and you just came back from Samoa. So I'd love to know what you did there. Please let us know.
Okay, last week,
Yes.
last week I was in Samoa, helping Samoa Red Cross, training with their volunteers. So the training is around epidemic control for volunteers,
Right.
helping volunteers understand how diseases are spread, and our role in that health story of when it started, how it became to be, and where it's going to go. Having volunteers understand that, because they're out there in the communities creating advocacy within the health space, and also preparedness for disaster. It's a program that not only was in Samoa for last week, but this week it happened in Vonualevu,
Right.
in Savusavu, Yaroi village, where our CBS officer Muhammad Sanif conducted a training to 20 community health workers across the Savusavu, Senganga, Lambasa, and Boa, trained on epidemic control for volunteers. And also part of the training was them learning about the community-based surveillance program. The training ended today, so they're returning back today. This program was piloted back in 2001 during COVID-19, where the Ministry of Health worked together with Fiji Red Cross in trying to reach out to communities they were unable to reach for surveillance, trying to find out if the people in the community are okay or not. So the program was adopted from Indonesia Red Cross, where our volunteers were trained, and it was piloted in Lambasa in 2021. And from November to May 2022, they saw that it has helped a lot in terms of surveillance from the community straight up to the Ministry of Health. So they've moved the program to the Western Division, where they trained 117 community health workers. And by the end of 2022, there was 201 communities trained under the community-based surveillance program.
Wow, that is so good.
Yes, and the reporting then was through Kobo, where it was generated from the ground, and Ministry of Health was able to tap into the real-time reports. So they transitioned to NIS, which is a dashboard, a system, where a community health worker, upon her visit in a community, comes across a family, for example, has diarrhea. And then upon her visit, she learns that the person has diarrhea. She is able to text a code that is linked to the definition of diarrhea straight to the dashboard. So if she does that, it appears on the dashboard and it is able to ping on the map. And we know that in that community, someone has diarrhea.
Wow, so real-time
data. So as soon as it receives by the dashboard sends a message back advising the person who has diarrhea to drink a lot of water, to have food, if it continues, to go and seek medical attention. So every household that has different kind of case definition is sent through the dashboard, and we are able to monitor. So we'll call our team leaders who are stationed out in the branches, and they verify that information. If it's a correct information, they escalate it. And when it's escalated, we work with the Ministry of Health. And if there's an outbreak of diarrhea in that community, the Ministry of Health are able to send their team to go and investigate what is causing the outbreak.
Wow, that is such a thorough response. I love that you guys have that. We're just going to take a quick break, but thank you so much, Salote. And we will be back after a short break here on Empower and Protect. Vinaka. Welcome back to Empower and Protect. We're here with Salote, Fiji Red Cross Society's Health and Care Coordinator. Hi Salote, let's continue the conversation.
Yes, please.
So I know that you have so many projects and programs happening right now in the community. I want to know that how do you consider people with disabilities in your planning and the action plan? Because I know that they often require a special type of care, especially when you're rolling out these programs. So can you please talk to that?
Oh, thank you. Well, we have our GESI focal points, which is gender equality, social inclusion, across the 16 branches of our society. So they've been trained under the GESI portfolio. protection and gender inclusion, and they are versed on how they include people with disability not only in planning of implementation of activities in communities, but also engage them when there's an implementation.
Okay.
So in overall for training with the programs that we have, when it comes to preparedness, we have our disaster team going out training volunteers and communities on community emergency response training. This training helps not only volunteers but the community as well, where they conduct the trainings in. They're inclusive of the members of the community. So part of the training is they have a walk throughout the communities, and they come and draw a map and identify the risk and the safest routes from each homes to the evacuation centers.
Yeah.
So people will think when there's a disaster, they say, okay, everybody, we need to go,
Yeah.
and they just rush out. So during this training, they're able to identify the weakest house to help with the tie downs, the strongest house who can be served as an evacuation center as well, and the safest routes from each homes to the main evacuation centers. They have different roles. So in a community, they have a community disaster committee, and that includes reps from each groups, like the women's group, the men's, the youth, the Sunday school, the church, the school.
Each subgroup.
Yes, it's a group of people, and they have reps. So they form this committee, and when it's during disaster period and there's a warning, they sit together and they map out the different roles of the communities, of the groups. So the women, their roles are to make sure that the household is set before, if they have to evacuate. They have to pack the food and everything sorted. So the men have their roles, make sure that the community is clean, tie down houses. The youth help with evacuating disabilities in the communities. Not just that, but pregnant women too, the elderly, the young children. Yes. So when they just don't bring them to the community hall. So within the community hall, the evacuation center, the committee has already allocated spaces or sections where they come and settle them in. There's always a space where disability or sick people come and stay in, sick bay, which is closer to the exits and closer to the convenient rooms. There's spaces for children, creating child-friendly spaces so that they are not affected about what's happening, but it's a space where they feel safe and they can be whoever they want to be. There's a space where women get to look after small children, the babies, or pregnant women.
Right.
So this is part of the training that is.
That's amazing.
And it's a session where it's given to people living with disabilities to voice out what they think about the training, about if it's going to happen. How do they feel? Would they be able to come to the evacuation center, or is it they want to stay home? Because for a person living with disability, a person who is unable to move, there's a lot of thoughts going on their head.
Yes, definitely.
They don't want to be burdened. They don't want people to.
They feel helpless.
Helpless.
Right?
Who will look after them when they're there? Because when they're home, they're safe. They can do whatever they want to do. But what will they do? Who will take them? Who will look after them? So part of the training is making sure that everybody understands how everybody feels. So in a normal situation, abnormal behavior is something we can refer as psychosocial support that needs. But in an abnormal situation with an abnormal behavior, that's normal. And that's where the training comes in, and people have to understand that people react differently when there's a disaster.
So true.
So 72 hours before a cyclone hits, there's always warnings. And that's where the community prepares, and people need to move. They start moving and preparing. And then 48 hours, and then 24 hours. And when there's a cyclone, like there's no movement. And there's 24 hours after cyclone. So the training covers preparedness, response, during and then after.
That is incredible.
That is part of preparedness. And also before it comes to that, we have our focal points in our 16 branches, creating awareness, not only in the branch, but also in their communities, piggybacking on all programs that are out there.
I love that. What really stands out from what you're saying is how thorough that your programs are. Thank you so much for explaining that. We're actually going to go for another break.
No worries.
Because you've done so well to explain. I've just forgotten that I'm the host. So yes, we will be back after a quick break. Naka. Welcome back to Empower and Protect. We're here with Salote from Fiji Red Cross Society. She is the Health and Care Coordinator. Hi Salote. So I've heard all about Red Cross. I've heard about the programs. I want to be a volunteer. Can you tell me?
Yes.
How can I be a volunteer?
Happy to share that information. So we have our website.
Right.
So it's on www.fijiredcross.org. So once you go into the website, you have a portal on how to become a volunteer. So anyone can be a volunteer. Anyone can be a volunteer.
Okay.
You can be working, you cannot be working, you can be in school, you can be a volunteer. So how do you register? You click on the portal and you just have ID, a valid ID with you. You fill in the details. And once you're done, once you submit it, the executives from the branches that you'll be, so for example, if you're in Suva, so you will be linked to the Suva branch. So the executives of the Suva branch will vet your application, and then within that application you have your contact details, like your email addresses, and they'll send you a notification that your application or your registration is successful and you're part of the Suva branch. So with that information, they'll be sending you meeting links. They're able to link you to the different programs that you're interested in, which is part of the application. And from there, then you'll be part of meetings, and if there are trainings, if there are workshops, if there are community engagement, that's when you come in. So you can be a member, a voting member.
Right.
That's where you pay a membership fee of $5 for general membership, and for youth is $350. But you can also be a full volunteer. No membership paid, but just be a volunteer for the society.
Nice. I love that you said anyone can be a volunteer.
Anyone can be a volunteer.
I want you to talk to us a bit about the diversity of your volunteers right now. What do they look like? How are they? Are there any criteria that you've put in place? Because anyone can be a volunteer,
yes,
right?
Thank you. So we've got professional volunteers, volunteers that are working. We have our honorable members of the board. We've got board members as well who are volunteers, and they're the governance of the society. Some they have consultation around the work that they do that is linked to the programs that we have. We have school programs also that is available within our programs, and with this diverse of volunteers that have registered. So we have some of our volunteers who are part of the disability group. They were unable to do activity works, community engagements or cleanup, but they can do advocacy.
Yeah, right.
Advocacy around the areas of the programs that we offer, and also how they are included in the programs that we have. A few years back, if you can recall, we have members of the Blind Association be part of our volunteer program as well.
Wow.
And it is always a privilege for us to work with them, because we're able to understand how they get to involve themselves in including how they feel when we run programs and we include them, and to hear them share that they feel that they're heard, that they're seen, is something that boosts our fundamental principles and that governs and guides us in the work that we do.
Yeah, that's so good to hear, because a lot of the time when people hear volunteers, they think, oh, I need to be physically fit enough to carry things and do things like that. But I love that you guys don't discriminate. You're like, whatever talents you want to bring to the table, please welcome. So thank you so much for sharing that. This interview has been so informative for me. I love the way that you have articulated what you guys' programs are, and also just the inclusivity and the how thorough your programs are. It's so inspirational. So thank you so much for coming. Just in closing, I know you have a few exciting projects coming up. Please tell the audience about that and how we can support your amazing work.
Thank you. Bulavinaka, ladies and gentlemen. Fiji Red Cross is inviting everyone to our Fiji Red Cross Ball, which is happening on the 1st of November, and it will be happening in Nandi. This ball, it's $350 for a person, a ticket, and we're selling tables, 10 tickets per table, which is $3,500. And if you click to our website or our Facebook page or social media platforms, we have the flyer there with the information. And if you need more clarification on the Fiji Red Cross Ball, please do send us an email or give us a call on the contact that has been given on our social media page. Whatever contribution that you give comes back to the programs that we carry out in communities, and that helps save lives. That is one. The second one is our blood program. We do not have a machine to generate blood, and we depend on donors in giving their blood to save lives. 1 pint of blood you give helps save 3 lives.
Wow.
And with that, we have a portal on our Facebook page, which is linked to a registration form. You can fill in the forms and be a voluntary donor, and we're able to contact you if there's donation around the area that you have registered yourself from. With that said, we work very closely with the Ministry of Health on this, and in our hospitals there is a dying need of blood, so that's where we come in and ask if you're willing to give blood, please fill in our form and we're able to contact you. And yes, the third one is our volunteer portal. Please do, if you have time, do register and be a volunteer. We have 16 branches across the country, all the way from Rotuma, and then Taviuni and Rambi, Maritimes, that is looked after our 16 branches. And we look forward to many, many, many volunteers who are there, who are willing to come and join the humanitarian space in helping the people of Fiji.
Amazing. Thank you so much, Salote. That is it for this episode of Empower and Protect with Salote from Fiji Red Cross Society. We'll see you next week. Vinaka.